Today's topic is going to be deliberate practice, which is really an exciting area, and it's brand new. And I think that's part of its excitement, especially with respect to its promise. And I think there are probably a half dozen people who are really helping shape what that looks like. And we're fortunate today to have Tony Rousmaniere as one of those people to talk to us about how it can look in supervision. Tony is a clinical faculty member at the University of Washington, is in private practice, has authored several books on deliberate practice. Maybe to get us started, would you talk about what deliberate practice is and just where the concept came from?
The concept came from K. Anders Ericsson, a psychologist in the field, the science of expertise. These are researchers who study how do professionals attain competence and then expertise, and then maintain that throughout their career, whether they're chess players or athletes or musicians or pilots or, what have you. And the best way to describe what deliberate practice is to actually, for me to ask the audience to think back on a time that you were learning a sport. So maybe in school, you were learning football, soccer, basketball, anything like that. And think about, what did you do to learn that sport? You typically went to practice where you would rehearse basic skills, do what's called drills, sometimes do scrimmages where you'd play kind of like fake games, and you do it again and again and again and again and again. And over time, you'd get better and better about the sport. Now, some people are just naturally gifted. They get better a lot quicker. And some people, like me with athletics, have a slightly harder hill to climb, so we'd get better a little slower. But we'd all get gradually better, and we'd never expect to get better unless we were practicing. It's the same with music as well. Think back to a musical instrument you learned. What did you do to get better at that instrument? Typically, you practice a bunch. Now, you might get coaching from a teacher, but what would the teacher ask you to do? They'd ask you to practice. Even with the best teacher, you just can't get much better without practicing.
You're mentioning that reminds me of K. Anders Ericsson's original work on this, which was with musicians.
They looked at classical violinist students at a music conservatory in Germany, and they had them record their training activities on diary cards. And then they looked for any training activities that reliably predicted the skill of the violinist. And they only found one. It wasn't age, gender, the type of violin, the type of training, anything like that. It was the number of hours the violinists had engaged in deliberate practice. And typically people are not surprised by this. This is not a controversial finding. This holds particular importance for psychotherapy, because I would suggest psychotherapy is not easier than sports. I would suggest it's not easier than music.
You've used metaphors of athletics and music, which I think are pretty common ones when you talk about deliberate practice. What are some of your ideas about how that should look in psychotherapy?
We're going to have to come up with our own methods of doing deliberate practice. And so we can kind of learn from other fields, but then we're just starting the process of researching how can it benefit deliberate practice. So with trainees, whether they're beginning trainees or maybe up to interns or something like that, we want to help the trainee engage in rehearsal, behavioral rehearsal, with what we call a stimuli that somewhat approximates the challenges they're going to face in therapy. So this is not theoretical. This is like something they're really going to face. With my colleague, Alexandre Vaz, created a series of stimuli videos using actors portraying common challenging situations in therapy. And these are situations all therapists are going to encounter sooner or later. We want them to be able to rehearse it. So when they're sitting with a real client, it's not their first time trying it out. What we've got here is a video of an actor portraying a client who's frustrated at his therapist. He's really not sure if therapy's helping. And I'm going to just play it for a little bit. All right?
Look, I don't want to be rude, but I'm not sure that therapy is helping. Now, I felt better when we started a few months ago, but now I feel worse. And I know that you're trying, but do you really think that this is helping? And how do you know for sure?
Okay, I'm going to pause it there. And so what we would ask the trainee to do is watch this video and then look at the client in the video and see, how would they respond? Just say it to the video. And they go ahead and say it. And then their supervisor, professor, we're trying to come up with kind of a new term for this, a coach, would provide feedback. You should have addressed this more. Oh, try to lean in when you're talking, or try to have a different tone of voice, or that kind of thing. Specific, concrete behavioral feedback. And then, crucially, they do it again. And then get feedback again. And then they do it again. And they get feedback again. And ideally, they would sit here for 10 or 15 minutes. Now, and this video clip is longer, and they could try other video clips, but they're rehearsing. They're really trying multiple times. Just like if you're learning piano, you don't just practice a piece once or twice or 3 times. You practice it 20 or 30 times.
Folks in our course, many use role plays. They talked about it in their supervision. So they rehearse it. It seems to me that what you're talking about that's a little different from that would be if it were deliberate practice, they wouldn't just rehearse it once in a role play. They would do it over and over for some number of times.
There's a few key differences here that are worth highlighting. First of all, when people do role plays, it often can go on for a while. Like the client says this, the therapist responds, the client says this, therapist, and so you can kind of role play 10, 20 minutes of therapy, right? Which is great. That's kind of like a scrimmage, like a mock game that goes on for a while. But what it doesn't provide is the opportunity for the trainee to repeat the same skill again and again and again and again. Deliberate practice theory and research suggests that actually a lot of repetitions are necessary to gain confidence and competence in a skill. And that's true across fields. It's true whether if you're learning to, yo-yo. I mean, whatever you're learning to do, repetition is necessary, right? So 1, we're providing repetition. 2, we're going to very carefully assess is the difficulty of the stimuli or the exercise in what's called the zone of proximal development for the trainee, meaning not too easy and not too hard. And this is different for each trainee because it has to do with how we were brought up and our own biases and our own strengths and weaknesses and that kind of thing. And so the video I just showed for some trainees might feel very easy. And for some trainees, it might just be too hard. Some trainees might just like freeze and be like, I have no idea what I would say. And so what the supervisor or coach should do in that situation is make the exercise a little easier, a little harder as the trainee rehearses. And then the third thing that's different is we are asking the supervisor or coach to really focus on behavioral feedback. What often happens in supervision is the supervisory dyad or the supervision group kind of drifts off into discussion of psychotherapy theory. With the book series, each book focuses on a major model of therapy. So the first book is on emotion-focused therapy, second book is on CBT, third book is on psychodynamic psychotherapy, so on and so forth. And each book is authored by leading supervisors and researchers in that model of therapy. And we asked the authors to identify 10 to 12 key skills that are essential for using that model of therapy. And then we're creating exercises with the authors for trainees and experienced professionals to achieve competency in that model of therapy. For EFT, one of the very basic key skills is expressing empathy to the client. And not only that, there's actually 5 or 6 different forms of empathy that an EFT therapist wants to be competent in. What we've done is created exercises where the therapist will practice or rehearse expressing empathy to a simulated client who's expressing some kind of symptoms. Now, some might say like, well, that's weird. How can you rehearse empathy? That's going to come across as like fake or forced or whatever, right? And that's part of the challenge is when you're rehearsing to actually for the therapist to stay true to what they're feeling, to stay real, to stay present. For the therapist to get a lot of practice kind of grounding in their emotional self, feeling empathy, and then expressing empathy in a way that's clear, that's coherent, that's accessible to the client. And we encourage therapists and supervisors to practice this for 20 or 30 minutes at a time. Now, as they practice, they're also assessing difficulty. So the supervisor is asking the therapist to go through what we call a difficulty assessment. This is the deliberate practice reaction form that the trainees or experienced therapists will use as they rehearse. And what they'll do is, if you see in this first box here, it says, how technically hard did the exercise feel? And what we're looking for is, does the exercise feel too easy, too hard, or is that at the right level of difficulty? And the same down here is, how emotional and uncomfortable did the exercise feel? Too easy, too hard, or at the right level of difficulty? And then there's questions about specific reactions. And so throughout the exercise, the supervisor or coach is going to help ensure that the exercise is done at the right level of difficulty. The same way, if you were in physical fitness training, your coach would be watching, okay, are you sweating? Because if you're not sweating, you're probably not getting stronger, right? But in the same line, are you getting cramps? Are you getting nauseous? Like, are you just falling over? Because if so, you're not benefiting either. They want the amount of weight, the number of repetitions to be closely aligned to what each trainee has for their zone of proximal development, which will be different for each trainee. For beginning therapists, everything is challenging to them typically, and they, you know what they, want help with, because it's kind of everything. For experienced therapists, one of the more tricky challenges is picking a skill target, which is, where do they want to focus deliberate practice? What skills do they personally find challenging with a current client that they are very motivated to work on? We want all three. So for example, common skill targets that I'll hear is, someone will have a client who won't stop talking. This is a common one. And the therapist just ends up sitting there kind of frozen and doesn't help. And so the skill target there would be, how can the therapist basically interrupt in a way that feels polite, congruent, that will end up feeling helpful for the client? Another example skill target is, therapists will say they have clients who are very evocative, who maybe just have very strong feelings. We're talking about trauma, and the therapist ends up feeling overwhelmed by what's going on. And so the skill target there will be, how can the therapist ground themselves, find a sense of confidence in themselves, even while the client is talking about very evocative material. So what I'd suggest for your group is to brainstorm what could be their personal skill targets with a current client, an area of challenge with a current client that they are very motivated to get better at.
Tony, with that exercise we just did, you've really moved us toward thinking about supervision and deliberate practice. So would you expand on that?
With training, like in a course at a graduate school, everyone's going to be doing the same thing. They're going to be going through the same exercises, and that's great. With supervision, you really want to customize it to your trainee. And of course, trainees have different experience levels, and they're bringing in different clients and that kind of thing. So there's a few tools I advise supervisors use in this regard. The first tool that is really, really valuable is if the trainees can videotape their sessions and you can review the videotapes together. The reason is that without videotape or audio tape, you don't really know what's going on in session. No matter how forthright the trainee is trying to be, our memories are just not built. There's all kinds of research showing eyewitness testimony is not reliable in almost any way. 10 different people at the same event will give 10 different descriptions of the event in very basic factual terms. And the therapist is engaging in the task. So asking them to also have good memory of it is just not realistic. I still videotape a lot of my sessions, and I'll see videos of myself. I'll be like, who is that? What is he doing with that client? So I need video to get feedback on what I'm doing. And I encourage all supervisors to try to get their trainees to videotape what they do. So you ask the trainee to bring in a video of a client where they feel stuck or they really want help. I ask them to pre-identify a spot in the video where they want help. And the reason is I really want to anchor this in the trainee's motivation. Deliberate practice is not easy. Therapy is not easy. And we want to use their motivation as much as possible. So they're starting at a point where they want help, and you just watch the video, ideally just for a minute or two. You don't watch 20 minutes of video or 30 minutes of video, because it's just way too much to work with. And typically after a minute or two, the supervisor can see something that maybe the trainee or therapist could do better. So we kind of talk about it with a trainee or therapist. It's really important that they agree on the tasks and goals of supervision. If they disagree, if they're just sitting there nodding their head, complying, it's not going to help. And this can be tricky because the trainees can be motivated to just agree. So it's important to create a collaborative relationship in supervision. And so once you've agreed on a skill focus, let's go back to the other example, interrupting a client who just won't stop talking. How do you do that politely in a way that feels helpful to the client without causing a rupture? There's two ways to do it. One way is to set up a role play where another trainee or the supervisor plays the client and the therapist gets to rehearse, or the therapist rehearses at the video. So at their client in the video.
I think that's one of the innovative things you've been doing.
The video of the therapy session serves as a stimulus that evokes emotional, psychological arousal in the therapist that's very realistic compared to what they're going to have in session with the client. This is one of the limits of traditional supervision, is the feeling of traditional supervision is very different than the feeling of therapy. And so something that a trainee can do with their supervisor doesn't necessarily carry over to what they can do with their client. And so if they're doing rehearsal with the video of their client, then they're actually, it's called state-dependent learning. They're more prepared to actually perform with the client. And so we'd show the client kind of talking nonstop, and then we'd ask the therapist to, okay, try interrupting the client. What would you say? And then the supervisor gives feedback, and then you rewind the tape and you do it again. And you do it again, and you do it again, and you do it again. Or you just let the tape keep playing. And you say, okay, now try interrupting them 20 times in a row. And I've done this. And the trainees it's really awkward at first, but after doing it 20 times, the trainees are like, I'm starting to get a hang of it. And then you can play with it a bit. You can be like, oh, well, try doing it in a high-pitched voice. Try doing it in a low-pitched voice. Try doing it in like the silliest way you can think of. And so they're just kind of stretching and playing with it and getting more comfortable and confident. So videos is a great way. Another thing you can do is what's called routine outcome monitoring or feedback-informed treatment, where the trainees are collecting routinely outcome data from the clients session by session by session. And the outcome data is typically a measure the clients take before every session regarding their symptoms that they've felt since the last session. And most ROM or FIT systems will, on a graph, plot the client's symptoms getting worse over time or improving over time. Now, the great thing about these systems is they can flag clients that are at risk of deterioration. So they'll often give them a red flag, a yellow flag, or a red flag. This is valuable because basically no therapists are really reliably good at identifying all of their clients that can deteriorate. And so if you use one of these systems, that can help identify clients to then videotape and use deliberate practice with.
So the routine outcome monitoring, which we did talk about in the prior class, so the folks are familiar with it generally, it's kind of a blunt instrument. It doesn't say what's going right or what's going wrong. It simply is a flag, as you're saying.
It's good for identifying the client. Unfortunately, it does not tell you what to do to improve, which is what we need. So that's where the role of the supervisor is really important. That's where you need the clinical expertise to come in and watch the video and say, oh, okay, well, what might really help here is having a stronger alliance or empathizing more with the client or what have you. And then those would be the skills to rehearse.
One thing that I've been impressed with our group is just how hard they're working. And they've got huge caseloads, and their supervisees do, and the supervision sessions are really pretty full with just kind of monitoring cases and so on. And I know one of the questions will be, how on earth do I squeeze this into something that's already happening?
Yeah, so that's one of maybe the most common questions. People are like, this is great in theory, but like, how am I going to fit it in? The good news is you don't have to do a lot for it to make a big difference. Typically, the way supervision goes is trainees have one or more clients that they're really worried about, can I help this client? Like things are not going well, that kind of thing, right? And ideally, there's video of the client and video of the situation where things are not going that well. And typically in supervision, the supervisor will do like a role play then, or more commonly, just kind of give advice, like this is what I would do, or this is what the research indicates. Now, what I would encourage your supervisors to consider is in that moment, creating a 5 or 10 minute pocket of time to rehearse repetitively the skills that they're describing, to actually watch, because usually what happens is the trainee sits there and they nod their head and they write down the notes, right? We want to see the trainee perform it multiple times. Rule of thumb is until you see a trainee perform successfully a skill 3 to 5 times or more, do not trust that they're going to be able to do it with a client, no matter how good their notes are. You know, I could take really good notes on how to win a basketball game, but if you put me down in the middle of an NBA game, even if you give me my notes, I'm not going to win that game. I got to rehearse, right? Psychotherapy is no easier. We got to rehearse. And so in that moment, if the supervisor can be like, okay, we're going to pause and we're just going to rehearse this a bunch of times, just that can not just give the trainee extra skill, but it can give them extra confidence. So when they're sitting with the client, they'll be thinking like, wait a minute, I did this. I've actually performed this multiple times. There's a chance that I can do it now. Another thing that would be valuable to discuss for supervisors is thinking of their trainees. What are common clinical skills that their trainees keep butting up against, having trouble with? Particularly skills that the trainees might understand intellectually, so maybe they could write a good paper about it, but they keep having trouble using, particularly with clients they find very evocative. And to make a short list of these, and for the supervisor to think, okay, how can I rehearse these with the trainees? Like, can I ask the trainees to bring in videos of themselves kind of flailing around this skill? Or, you know, from the website I showed earlier, are there a stimuli video on the website that I could ask the trainees to rehearse with? And then what barriers might come up to rehearsing these skills? Like how am I going to manage my time? How am I going to remember to do this? You know, what do I want to give the trainees any preparatory reading about deliberate practice? You know, that kind of stuff.
One of the assumptions I think people have about deliberate practice is that it focuses on overt skills. So technical skills, or you've given some examples of interpersonal skills, but I know you've been doing work to develop deliberate practice exercises to help with inner experiences, like countertransference.
This is something I picked up in my own training. Was when I sat with some clients, I would just feel my own anxiety. I'd feel my own very strong feelings of different kinds. I'd freak out, you know, so to speak. Even though on the surface, I might have been able to, like, you know, make myself look composed. Internally, I was very uncomfortable, you know, and sometimes there's clients with trauma or clients that reminded me of, you know, my history or whatever, right? So whether you call that experiential avoidance or you call that countertransference, like every model acknowledges that this is a major challenge in therapy, right? That we have to be able to really tolerate our internal experience while staying attuned with the client, right? We don't get to just dump, you know, a bucket of water on the client and put out all their symptoms right away like a medical professional does, right? Like we actually have to be able to sit with the client while they're suffering and attune with them very closely. And so one thing we've been experimenting with is how can we use deliberate practice to build what we call intrapersonal skills of being able to stay self-aware, self-regulated, attuned, kind of with ourselves, so then we can also be attuned with the client. And that's a whole nother batch of exercises that I wrote about in my most recent book, Mastering the Inner Skills of Psychotherapy. And there's exercises on our website as well.
Okay. I've got a supervisee who's got a client who just elicits a lot of irritation and anger.
Yeah.
What might I do with that supervisee to help them using deliberate practice?
Great. So of course, this is very common. So what I would do is I would ask the supervisee, ideally, they would videotape that client, and the supervisee would sit with the video of the client. The supervisee would hit play on the video, maybe turn the volume down about halfway so you can just barely hear the client. You don't really want to hear everything they're saying. And as the supervisee is watching the video of the client, their task, the exercise, is for them to track their own reactions, right? So their thoughts, feelings, their body sensations, and behavioral urges. They're building their skill of self-awareness, ideally with self-compassion at the same time. So for example, the trainee might say like, oh, I notice myself getting tense, or I notice that I want to look away from the client, or I notice I want to argue with the client, or I notice I want to detach from the client, or I notice, you know, my palms are getting cold, or my mouth is getting dry, or whatever it is, right? Or I notice as I get angry at the client, I start to feel embarrassed or guilty, like I shouldn't be angry at the client. And you're trying to just flush all this stuff out. And you're not trying to like solve any of this. These are all very natural reactions. These are human reactions. All these reactions show that the trainee's limbic system is working very well, right? To having reactions to the client. What we're trying to do is help the trainee build their self-awareness and ideally self-compassion around these reactions so that when they're sitting with their client, it doesn't freak them out as much, that they're able to handle it. And one thing we emphasize here is we're not turning supervision into therapy, right? It's not the trainee doing therapy with a supervisor, it's the trainee rehearsing with the video of their own client. So it kind of protects the frame and the boundaries of the trainee.
Mm-hmm. Perfect. Well, thank you so much, Tony. And before we go, would you talk about where people who are interested in this might learn more?
Yeah, so we've developed this website, which I'll share here. It's dp4therapist.com. And it's called the Deliberate Practice Institute. It's where we're hosting a bunch of information. If we go to resources, here's the video exercises. Here's the stimuli videos. So the one I was showing before was the angry man. We've also got a flirty woman. We've got a suicidal woman. We've got an abused woman. These all present actors portraying clients, portraying very common challenging situations in therapy. They're broken down into starting, easier, and harder difficulties. And then we also have video exercises that trainees can do in supervision, in class, or also as homework. I've heard of professors assigning these as homework. And then what we're building towards is a certification standard, which will be administered through this website, where we'll certify therapists in using deliberate practice, and then also certify supervisors as deliberate practice coaches. So stay tuned.
Thanks so much, Tony. As usual, this has stimulated lots of new thoughts for me and I hope for our group as well.
Cool. Thank you, Rod. I really appreciate it.